Hello, my name is Kiara, and this is my professional development plan for my journey to become an adult gerontology acute care nurse practitioner. I have three main goals I want to achieve within the 5 years. These include graduating NP school and passing my boards. Second, I would like to work as a board-certified nurse practitioner by first receiving all the necessary requirements to get this achievement. And finally, I would like to work with other nurse practitioners in a nurse practitioner-driven cardiac ICU. My timeline is rather broad, but it hits the main points I hope to accomplish during my 5-year plan. It is broken up by year. According to my due matriculation plan, my planned graduation date is the summer of 2020, which means that I can sit for my exam September 1st, 2020, and will hopefully pass. By January, I would like to have started to work as a board-certified nurse practitioner on a regular hospital floor. This requires first having received all of the necessary certifications to do so. After having worked on a hospital floor for the last couple of years, I would then like to move to work with more cardiac-focused patients. From 2022 to the end of 2023, I would like to gain experience working with cardiac-type patients. And finally, in 2024, I would like to achieve my ultimate goal of starting to work in a primary nurse practitioner-driven cardiac ICU. There are numerous requirements to get licensed as a nurse practitioner, and I will go into depth on the next couple of slides about these requirements. As graduation nears closer, I would first develop a study plan. As of now, I plan to obtain all of my study resources through the American Association of Critical Care Nurses. They have a course, textbook, and sample exam to prepare you for this exam. Of note, the ANCC also offers certification for the acute care nurse practitioner. Once ready to sit for the exam, I would first go on to the AACN website. The application for the AACN is straightforward, but requires the individual to be graduated first from an accredited program, have at least 500 clinical hours, and have practiced with the adult geriatric population. According to the AACN, if you meet those requirements, you can fill out an application and submit this application for approval. Once approved, one can schedule the exam within 1 to 2 weeks at the approved testing center. These can be found on the AACN website. Next, pass your boards. After getting certified in Connecticut, the next step is to apply for licensure through the Connecticut State Board of Nursing. Similarly to your RN license, you pay a fee and obtain a license number. In Connecticut, one must have 30 hours of pharmacology to apply for this license. After obtaining a license number, the next step in the state of Connecticut is to apply for the controlled substance registration. In Connecticut, this is mandatory before applying for the DEA number or a DEA registration. Once completing that application, one can finally apply for the DEA registration number or the Drug Enforcement Administration number. In Connecticut, APRNs can practice alone, but they're required to work with a collaborating physician for at least 3 years prior and obtain a minimum of 2,000 collaborative hours with the physician. There's a number of crucial things to keep in mind when seeking employment as a nurse practitioner. Contracts should be provided and should include information about the job itself, benefit, and specific employment arrangements. Information such as tuition reimbursement and prior agreements should also be stated in the contract. Salaries can often be hard topics to discuss. However, it is important to know the different types of salaries, as most RN salaries are hourly. Straight salaries are those salaries which are fixed. This means that the person will receive the same amount regardless of the hours worked or patients seen. Percentage of net receipt salary is based on the number of patients seen. It's calculated from the NP's bill minus the NP's portion of practice expenses. Base salaries plus percentage is when the nurse practitioner gets a base salary plus additional money if income is generated over a set rate. And finally, hourly salary is a salary based on the number of hours worked. Negotiation is recommended when discussing employment options. Practice expenses such as malpractice insurance, vacation time, continuing education, health insurance should all be negotiated with the employer. Additionally, of note, most hospitals require malpractice insurance. Additionally, it's important to keep in mind also that credentialing for a job can take anywhere from 6 weeks to 3 months. Reimbursement can get confusing, and in order to be paid for your services, there are specific applications that must be completed. These are usually completed by a practice manager or in combination with a practice manager, but it's a good idea to know what is required just in case, or to get an overview of what is required. The National Provider Identifier is an application that provides you with an ID number, which helps to aid in the completion of other reimbursement information. The Medicare Provider Enrollment is an application that allows the provider to receive reimbursement for Medicare expenses. This can be completed online. Similarly, the Medicaid Provider Enrollment is also an online application that allows the individual to receive reimbursement for Medicaid expenses. However, Medicaid Provider Enrollment is state-specific. This is a list of the total expenses that someone in Connecticut would expect to pay in order to become a board-certified nurse practitioner. As you can see, it's very expensive. Some institutions, especially institutions that are hiring nurses, will reimburse for some specific fees such as DEA registration. However, rules and regulations regarding reimbursements are different per institution. Professional development is important and crucial in order to be successful as a nurse practitioner. One aspect that's important is this idea of networking. Locally in Connecticut, there are many networking opportunities available, especially in the current workplace I work at. Danbury Hospital has multiple events for all hospital's employees to encourage networking. Additionally, there's also a lot of support with networking through the Connecticut Advanced Practice Registered Nurse Society. This society is a local website which provides information for APRNs in Connecticut. Information ranges from career opportunities to upcoming events. These upcoming events are a useful way to network in and across the Connecticut area and allows for one to meet different nurse practitioners and APRNs in Connecticut. Nationally, networking can be done through the use of conferences. There are many conferences that one can attend. To list a few, there's some offered through the American Association of Critical Care Nurses, AANP, Sigma Theta Tau, NTI, and etc. Mentoring and collaboration is very important, especially as a new nurse practitioner, and can be crucial in order to be successful. Websites such as the ENP Network offers networking opportunities which connect nurse practitioners with different colleagues in similar areas. Additionally, the AANP offers an FAANP mentorship program, which is a program that provides nurses with fellows who are specialists and leaders in their fields. Scholarship is very important. As you have seen above, the cost of just getting your nurse practitioner license alone can be very expensive, and a lot of students come out of school carrying massive amounts of debt. As a result, it's important as a nurse practitioner and nurse practitioner student to consider the many scholarship opportunities available. Locally for me, there is the Linda Elmira Nursing Education Scholarship. This is a local scholarship offered through the hospital I currently work at, which offers all nursing students opportunities for tuition reimbursement. Applicants are chosen based on merit and need-based. Nationally, the AANP also offers numerous scholarship opportunities along with tuition reimbursement opportunities. Some of these can provide up to $2,500 to students. Additionally, there are certain programs which offer full loan repayment options. These are usually for more primary care specialized areas and for areas that are more rural. As a nurse practitioner, it is very important to be involved in professional organizations as they can provide many resources and career opportunities. Some of these can include the Gerontological Advanced Practice Nursing Association, the American Association of Nurse Practitioners, the American Association of Critical Care Nurses, and the National Organization of Nurse Practitioners Faculties. Continuing education and formal education is very important for a nurse practitioner, as many licenses in certain states, such as Connecticut, require a certain number of medical education hours in order to stay certified. The American Association of Nurse Practitioners offers continuing education through their website. Additionally, other organizations such as the National Practitioners Association for Continuing Education offers educational opportunities either through upcoming conferences or continuing education modules. The AACN offers free access to continuing education models, and with a subscription offers hundreds of interesting continuing education models with current focus on current practice changes and clinical opportunities. All of these opportunities allows a nurse practitioner to stay up to date on current trends and practices in healthcare and are recommended.